The brain is the seat of who we are as human beings.
It is the center for everything. Who we are, how we perceive things around us, how we interact with others.
To write poetry, to love, do all these things that make us uniquely human. Those are the functions of the brain.
There's so many questions that we can ask. How does learning and memory work? Why are we self-aware?
You discover one mechanism only to realize that there are about 1,000 different mechanisms lurking behind that one mechanism.
And then you realize how little we actually know, even at this point.
The great scourges of the coming century are going to be brain-based disorders.
It has been a problem that has had a tremendous impact in our society, but has not been prioritized.
1 in 3 Canadians are directly impacted by disorders of the brain. That's more than those impacted by cancer and heart disease combined. And yet, the funding in the area of brain research is significantly less.
Michael Wilson and Alan Taylor shared with me this vision that they had to create an organization that was going to be the catalyst to address the fragmentation of the brain research community at the time and bring all the players together, and also fund ideas that were not based on one institution or one geographic location or one particular disorder, but really had the freedom to explore the whole brain.
Brain Canada has been instrumental in getting many multidisciplinary projects going in Canada that otherwise would not have gotten going.
Canada is, I think, in a privileged position. It's large enough to have an impact on the scientific stage, but it's small enough to be organizable.
One example is Dr. Calloway's project here on ALS.
ALS stands for amyotrophic lateral sclerosis. It's better known as Lou Gehrig's disease, but in fact we know that not everybody has the same disease that Lou Gehrig had. They present with different symptoms and signs. What parts of the brain are not working well? What parts are dysfunctional? And how does that relate to the symptoms that someone with ALS has? With the MRI machines, we're doing brain imaging to see if we can measure the disease that they have. What's really exciting here is the fact that we're now doing it across Canada. For instance, Dr. Nicolas Dupré and Dr. Annie Dion, they're working in Quebec City.
Chaque centre collecte des données sur plusieurs années et faire des analyses comparatives des patients les uns avec les autres. Avec les techniques d'imagerie, avec les recherches qu'on peut faire sur les différents biomarqueurs, avec les techniques de génomique, on arrive à un moment où la collecte d'informations peut nous permettre de faire des pas importants au niveau des thérapies, ce qui n'était pas possible il y a 5 ans ou il y a 10 ans.
And the idea then is to understand in a much larger population, and a population that's representative of all of Canada, how can we develop that tool to help us eventually find a cure? Brain Canada has played a key role in providing substantial funds to make a large project like this feasible.
A brain bank is basically a facility that collects, preserved, catalog the brain tissue. The brain bank is essential to individuals like myself who are interested in understanding what happens in the brain of people who are ill. There are no ways of getting funding for facilities like the brain bank. Finally, someone in Canada recognized the need of supporting valuable infrastructure. The brain remains the last frontier of medicine.
Depression is right now the leading cause of disability worldwide.
This is probably the most important problem at this point in mental health in Canada.
In the case of major depression, at least 1 out of 3 people will not get better on either medications or therapy. So there's a big push on right now to try and develop a new generation of treatments.
The more people that participate, the more you learn and the more impact it has on society. And so we can do that far more quickly if we involve multiple partners. And that was the genesis of the multi-center trial. Us, Jonathan Downer's group, and Fidel Villa Rodriguez's group. The other component to the trial is through Dr. Sidney Kennedy.
Where Brain Canada comes in is that we actually were able to partner and link in with Dr. Daskalakis and other colleagues to be able to study other treatment applications.
Until very recently, delivering a treatment took 40 minutes every day, Monday to Friday, for 4 to 6 weeks.
Some of the work that we've been involved with is a treatment called theta burst stimulation. And a treatment session can be delivered in less than 5 minutes.
5 years from now, we hope the devices will be still further miniaturized, safe enough to be actually taken home so that people can experience full recovery from depression, not in a matter of weeks or months, but perhaps in a matter of days.
Brain Canada really aims at funding that research that it's not only cutting edge, but has that potential to translate into making a difference in people, in individuals.
We built this organization for 10 years before we went to government and asked them to partner with us to expand the vision. But the vision was there.
When we went to the federal government, we were saying, we'd like you to help fund this research, but we'll do it on a matched donor basis. So you put $1 in, we'll find a private or a corporate dollar to match it with.
All of the funding decisions are done by peer review, meaning we strike a team of international scientists who get together and adjudicate the proposals that come forward, and the best team based on merit wins.
It's not possible for one person to have all this expertise, so you really need to put a team together. I appreciate that Brain Canada understands that and includes that in the calls for applications that they put out.
Brain Canada will give us the opportunity to do something that's high risk, but if it works, the rewards will be large.
Over the years, Brain Canada did the initial funding, but then different organizations have picked up that funding and really furthered it along.
We want to ensure that this research is actually aimed at achieving some outcome that is eventually going to benefit patients, families, and caregivers.
So we have the academic institutions bringing innovation, the biotech company and the pharma industry who knows how to develop the technology into a product.
We're not chasing people from other areas of the globe. We're leading, we're defining the new areas where science is going. This is a fundamental aspect to the projects that are getting funded by Brain Canada.
It's often said that Canada punches above its weight in the area of brain research. What's important now is to ensure that that remains the case for the future. And it's exciting that Brain Canada is fostering and supporting young talent.
To watch some of these projects that have achieved their goals, to see the discoveries that have been made, to see the potential application, and also to look at the promise of the technology that's now coming to play, look at what data can achieve in terms of personalized medicine.
Come and join something that is so unique, so interesting, that has so much impact on Canadian society.
It's a very basic question. What are we going to do about the 1 in 3 Canadians who suffer from a brain disorder? We need to support great brain research, big, bold brain science, and that's what Brain Canada is about.